Now, I have interviewed a number of people about the keto diet, and as I understand it, the keto diet has good evidence for the fact that it is good for weight loss, and it's also good for reversing type 2 diabetes. So how does that sit with your plant-based approach to nutrition? Because obviously it is much more difficult to follow a keto diet if you're vegetarian or vegan, and probably if you cut out the red meats you can still do it fairly easily. But
yeah, so another broad topic really, and I think I agree with you that a low carbohydrate, or if you go even further and very low carb and become ketogenic, that the short-term data, and most of the studies are less than 2 years, show that it can support weight loss if that's required and support better glucose regulation. But longer-term studies, especially if you're doing an animal-based low-carb or keto diet, show that for all the reasons that we know, the long-term health suffers increased cardiovascular disease because of the high levels of saturated fat, and hence the rise in cholesterol that happens in significant proportion of people following this pattern of eating, increases your risk of cancer such as colorectal cancer, and increases your risk of premature death. So it's not really a long-term solution. And to be honest, I could say about any sort of diet pattern that reduces calorie intake and avoids processed foods would be able to lose weight, and weight loss is required for type 2 diabetes reversal. So whatever, if you want to reverse or put type 2 diabetes into remission, the vast majority of people have to lose weight. The NHS has gone down the route of total replacement, food replacement, I think that's the right term, where they give those low calorie shakes, 800 calories a day. People who lose more than 15 kilograms, you've got a more than 80% chance of putting it into remission. If a low carb diet can help you lose weight, you will put your type 2 diabetes in remission. I would then point you to the vast amount of data supporting healthy plant-based diets, which are low in calories, high in nutrients, high fiber, protect your long-term health, that also show the same. So it's not like the one or the other when it comes to diabetes reversal, but I do think you need to think about your long-term health, and a plant-based diet is very much embedded for cancer prevention guidelines. So you don't need to choose what you're trying to prevent. There is a lot of research ongoing on the ketogenic diet, but I've not seen any real convincing human data to suggest it's going to be a goer long term. Having said that, you can of course do a low carbohydrate plant-based diet if that's what you want to try. David Jenkins, a professor, he was trained in the UK but works at the University of Toronto. He's the chap that created the portfolio diet and also the glycemic index. He has pioneered randomized studies on the Eco-Atkins diet. So it's a plant-based, vegan, low-carb diet. And yeah, for some people, having less carbohydrates, higher fat, higher protein may work for them, but I think it's the wrong approach to be basing a diet around your macronutrients. We should just be eating foods that we know promote good health, and that's a combination of fruits, vegetables, whole grains, beans, nuts and seeds.